So, you've made it back to the station. We transferred this patient with meningitis. You talked to the infection control person at the hospital who actually said, well, no, that person had strep pneumo. They didn't actually have Neisseria, so you don't need any prophylactic antibiotics. You're okay. Go back to work. And you say, okay. No sooner do you get back to the station and you're just thinking, man, dinner's going to be good this evening, when you are toned out again. You are toned out this time to what can only be described as the hippie camp on the edge of town. The one in the woods with like all the junk in the buildings and stuff. The one where nobody likes to go. That one. You're toned out to a 23-year-old female with a history or with headache and altered mental status. You arrive and you find this is camp that looks something like you see here. It is the weird hippie place in the woods. Many people, not a shoe to be found among them. Friends called EMS this morning for this lady who had been living there for about the last 6 months. When they couldn't get her out of bed this morning, she was mumbling to herself, and they thought maybe she does use some drugs every now and then, but we thought maybe she got into some bad stuff, and when she didn't get up by now the late afternoon, we thought we better call and get her checked out. So you find this 23-year-old female laying in bed. She opens her eyes to you, mumbles answers, and has some purposeful movement, and tries to cover herself back up with like the little shards of a blanket that she's got there. She looks something similar to what we saw before. Her vital signs look similar to what we kind of saw before now. She's a little bit more tachycardic, though, at 125. Respiratory is, again, a little bit high, which, again, a high respiratory rate, usually a true high respiratory rate means something's going on often. And she's a little bit febrile at 102, which you took because you're an astute pre-hospital care provider and you really care about everything. So you take this young lady to the hospital, and you get a call again about 6 hours later, this time by the nurse again, who says, hey, you may want to get yourself checked out because she has herpes encephalitis. See how I did that there? Encephalitis, to differentiate it from meningitis. Meningitis, again, the meninges, the stuff that covers the brain itself, when those get inflamed, that's meningitis, and that's generally a bacterial process. Encephalitis itself is inflammation of the brain tissue, and certainly with meningitis you can get inflammation of the brain tissue of the gray matter itself, and not just the covering, and you call it a meningoencephalitis at that point. But encephalitis refers to irritation of the brain, infection of the brain itself, and usually you think about this in the setting of a viral process. And this can be, it's not just swelling. When you really look at what happens, this is a gross section, and of course this is from somebody who died as a result. But you can see that this encephalitis, even this viral stuff, from viruses that otherwise, don't cause really terrible infections, or at least the infections that cause you to die, you can see how it really messes up your brain. All these little spots here, you can find little hemorrhagic spots in here. This is all area where the brain's getting destroyed as a result of an infection. And again, generally speaking, while it can be encephalitis from other things, it is most commonly thought of in the setting of viruses. What specific viruses themselves? Again, these are ones that normally, these are the same viruses, it just happens to be where they end up. So herpes simplex, this guy at the top, the same thing causes cold sores. Zoster, things that cause chickenpox and shingles. Measles and mumps, when you hear the anti-vax people, which maybe is a different story, but let's just say that kids that got measles, most kids got measles. You know what? Not a small number of kids also died from encephalitis as a result of them. So the commonly thought of like childhood diseases, well, yeah, they were common. Lots of people got them, but a number of people actually die from it as well, often from that encephalitis picture. And then EBV, the one that we usually think of as causing mono in young adults or in kids, excuse me, can cause a pretty nasty encephalitis. And then what you probably have thought of most commonly when you've heard the term encephalitis is the mosquito-borne disease, so like West Nile virus or Eastern equine encephalitis. Those guys, those guys are ones that generally that we often have thought of, at least in popular culture, that can cause encephalitis as well. And again, those are viral things that are transmitted through mosquitoes. There's some tick-borne things that'll do it. There's all kinds of stuff that'll do it. What is this going to look like? Well, it's sort of going to look like the meningitis thing again. All these infections, what do they have? They got fever, they got headache or pain. The big thing that differentiates the encephalitis is really this altered mental status or brain dysfunction. And what does brain dysfunction mean in this case? It could be almost anything. So you could have memory loss. It could be that you just can't remember stuff. It could be that you're disoriented or hallucinating or seem psychotic. Now, how many old folks have you picked up from a nursing home that have memory loss, disorientation, and hallucinations and are a little bit febrile as well? Are these folks, do they have encephalitis? I don't know. That's what makes this kind of hard. Things like personality changes even, or agitation. So you pick up a young guy who is out thrashing around the street, picking up garbage cans and acting, like a giant raccoon, basically, who's agitated, that you're thinking like, man, this is meth, this is PCP, this is something like that. Well, maybe his altered mental status and his elevated body temperature are not due to his agitation and his meth use, but actually to encephalitis. That's one of the big problems with it. And these can look like any sort of neurological process as well. They can look like a stroke. They can present with hemiparesis, because if you get swelling on just sort of half of your brain, then half your body stops working and it looks like a stroke. Or vision loss, seizures, all this can be encephalitis. It could be a stroke. They could be crazy. They could be on drugs. They could have heat stroke. They could have two of these things, or they could have encephalitis, and they all kind of look the same. So we have to have a high index of suspicion for this stuff, in that, yes, this guy is probably on meth, just playing the odds, but also, if there's no meth to be found and his family is insistent that no, he's not a meth user and doesn't use any drugs and he's been this way for a couple of days and seems to be getting worse, don't necessarily attribute that to to drug use or to some sort of stimulant use. This could be something else. So watch out. And as I can't remember what show it was or what thing it was, but big point that is worth mentioning, certainly, think encephalitis. If you got fever and altered mental status, think encephalitis. This is potentially somebody that is pretty sick, and don't just write them off as crazy drug user, little fever old lady from the hospital who has or from the nursing home who has a UTI or something like that. Think encephalitis. That's the best thing we can all do for it, and treat these people as if they potentially have the really bad stuff. Now, what is the treatment for it? It's mostly supportive, honestly. There is a little bit of antiviral stuff that you can use. So folks with like herpes encephalitis, which again, herpes, same thing as that gives you the cold sores. Herpes encephalitis, which is not super uncommon as far as these things go, and is one of the really bad ones. Those folks may be, they might get some acyclovir. Some of the other things that we do is support, if they have seizures, we give them Versed or Ativan or whatever it is to calm their seizures down, treat them as they normally would. Again, if they're altered, fever and altered, yes, think encephalitis, but also think hypoglycemia. Get a blood sugar on these folks if they are hypoglycemic. It doesn't necessarily rule out anything else, but treat their hypoglycemia. And do all the good, critical, supportive stuff for it. And that's how we were able to get some of these people through it, is just with good, supportive care. Because there's not a whole lot of viral treatments that are really out there that are, that are actually all that effective. So, good supportive care, good index of suspicion for it, and treat pretend, although they may be, PCP'd out, treat everybody as if potentially they have some sort of infectious thing that's going on otherwise, because that may be something that we can do something about that they're not going to get a whole lot better otherwise. Cool, huh? There's one other thing that I wanted to talk about. And this goes along with the encephalitis. What I consider the most terrifying disease in the world, the thing that absolutely, scares many of us into getting medical treatments that we probably didn't really need. But in order to avoid this particular disease, we do a ton of stuff, because it is, again, the most terrifying disease in the world that you wouldn't want to get. And so we do a lot of stuff that in any other disease process we would say, well, that's silly. Why would you treat that? What disease is it? Well, rabies. Rabies is a virus. Rabies encephalitis is absolutely terrible. And in the setting of probably 60,000 cases a year, I think is the kind of worldwide number now, a handful have ever survived. So when you say the full-blown, furious rabies, full-blown crazy rabies, the folks you think of that are really symptomatic, human history has recorded maybe 10 of these people that have survived out of 60,000 people dying a year. That's bad odds. And we've known about rabies for some time. I remember reading a book when I was a little kid. I read it to my kids now about the invention of the rabies vaccine and how Louis Pasteur, if you really think about it, if you got bitten by a rabid dog, by a mad dog at that point in the 1800s, you died. And you didn't just die like that day. You had a couple of days to kind of think about it and worry about it. And then you started to get sick over a couple of days. And then you had this really terrible disease for the next couple of days. And then you basically got paralyzed. And then you died a couple of days after that. Really horrible, terrifying thing. And luckily there is treatment that's almost 100% effective. Essentially, for lack of a better term, 100% effective if you think about it. So let's talk about rabies, the specific encephalitis that is the most terrifying thing in the world. God. All right. Rabies is a bullet-shaped virus. It looks something like this. The virology itself is not all that important. Just know that it's a virus. It affects mammals. So fish bites, lizard bites, they don't have rabies in them. You don't have to worry about it. And it affects different reservoirs of mammals differently. So in the United States, the classic ones we sort of think of are the terrestrial carnivores like raccoons. Possums are actually somewhat resistant to it, but still could have it. Dogs, bats, that sort of stuff. The small animals like rabbits or squirrels or those kind of guys tend to be less of a vector. But essentially any animal could get it. Cows could get it. Horses could get it. Any mammal is potentially susceptible to it. We only get about 1 to 3 actual cases of rabies every year in the United States, but about 55,000 Americans get post-exposure prophylaxis according to the CDC. So out of all that, we only get really one or 2 cases each year, and usually those are folks that just weren't in a means where they could get post-exposure prophylaxis because they didn't realize it, or they didn't know that they needed it, or they're homeless and have no access to medical care and just didn't get seen after their raccoon bite, something like that. Again, how does it sort of happen? It's transmitted through the saliva of infected animals. And let me get myself out of the way here for a second. Again, the common reservoir that we think of is dogs because it's really dramatic, and that's where it used to be, but with large-scale vaccination programs, that has actually been able to be whittled down to now you just get it's about 1% of the cases come from dogs themselves. The most common ones are bats by far. It's like 80% of the cases in the United States or 80% of the exposures are due to bats. There is also the chance that you could get this from a solid organ, which has only really happened one time that we know of or that's been reported. It may have happened other times, we just didn't realize it. But yeah, that's sort of terrifying. Man, you get a liver from somebody and now you have rabies. Watch out for that one. So in 2008, they actually added a screening question on things like rabies. But that's, golly, terrible. What happens when you get bitten by a rabid animal? Well, again, the bacteria, the virus congregates in the salivary glands of the animal itself, and as a result of the neurological dysfunction that'll happen later, the dog or the bat or whatever it is, the human that is infected can't swallow. Because when they swallow, they get terrible spasms in their throat, and they essentially regurgitate everything that is there. We'll see all this in just a second here. But subsequently, you can't swallow your saliva, and subsequently, you drool a lot, or the dog drools a lot, and there's a lot of saliva that's coming out there, which means a lot of potential way for the virus to spread. When the animal bites you, you inoculate with that saliva the immediate area, like the muscle tissue and the subcutaneous tissue, with that bit of saliva and spittle and the little rabies particles. The rabies particles enter into your body and they start to replicate in that area. They make their way down to the muscle and to the nerves that innervate that muscle. and then they track on up the nervous system, eventually back to your spinal cord. They're replicating. They hit your, so it takes a little while, depending on where it's at, to actually make this, to climb all the way up there. If you're bitten on the lower extremity, it's a longer period of time to make their way up to the brain itself. If you're bitten on the upper extremity or the face, it takes significantly less time for it, and so you see symptoms sooner. When you hit the brain, that's when you start to get the actual symptoms. Up until that point, you're largely asymptomatic. And it takes a couple of days of replicating in the brain before you actually start to develop the symptoms. Once you start to get this encephalitis, you start to get more of the virus moving into your organs and your salivary glands, which again makes it more likely that if you're an animal and you bite somebody else, that you pass on the rabies virus. It's a pretty smart little virus in that way. Once symptoms start, once you start to get symptoms of CNS infection, of that encephalitis, once it reaches your brain and really starts to cause symptoms, it's about 7 to 10 day course for the disease. And this is an old video, and it's again somewhat terrifying, but I think really shows you a good example, because we don't see a whole lot of full-blown bad rabies anymore because our prophylaxis is so good and we do it so often. But actual rabies looks something like this. So
this group of villagers from the backcountry of Iran were all attacked and bitten by a rabid wolf. They have come to a local facility of the Pasteur Institute in order to receive treatment. This man developed symptoms of rabies. On the third day of the disease, he displays a characteristic restlessness and agitation. The most familiar clinical symptom of rabies is associated with difficulty in swallowing. When fluid comes in contact with the throat, it is violently expelled, at the same time producing painful, spasmodic muscular contractions, hence the term hydrophobia, or fear of water. The accessory muscles of respiration are also affected by the attempt to swallow, so that the patient chokes and gasps for air. In order to avoid swallowing, he drools accumulated saliva into a cup. By the fifth day, salivation is copious and almost continuous. There is excessive perspiration, and the pupils are dilated. As a precaution against the convulsions which commonly occur in rabies, the patient is secured hand and foot. He displays increasing agitation and delirium. If the acute excitement phase of rabies is survived, paralysis sets in, accompanied by apathy and stupor. The patient becomes quieter. He lapses into a coma, which is followed, inevitably, by death.
all right, so again, it's Halloween time, so I thought I would show a terrifying video. Now, of course, the really bad part is that since this was developed, I don't know when they made this video specifically, but in the the 50s or 60s, certainly probably the 50s from the look of it, The treatment is largely the same. Once you develop like the actual symptomatic rabies, that's treatment is pretty much the same as that. There's more sedation, there's more like drugs involved, but you still are basically stuck. We'll talk about the potential treatment here in just a second, but yeah, treatment is basically the same. However, there is actually a super effective treatment if you can get it before you become symptomatic. So, in the time following the bite, you have anywhere from, immediately is better, but up to 7 to 10 days. Treatment is still very effective. And what is the treatment? It's a combination of two things. Well, number one, you get the rabies vaccine, which is a killed virus. You inject it into the arm, and it generates an immune response. You generate antibodies to rabies, and then those things go off and attack the little viral particles. And you get a number of these to try to like boost your immune system. Like, hey, come on, go make some antibodies, do this stuff. So that's why you get a series of injections, all of rabies vaccine immediately following the inoculation itself or the potential exposure. The other thing that we do is not just give rabies vaccine, but we also give rabies immune globulin, which are preformed antibodies. These are manufactured antibodies that you take and you dose it based on weight, and you inject those. If you get bitten on the arm, then you basically take the serum of antibodies and you inject it all around that area. Why? Because that's where the little viral particles are sitting, and it's sort of like people used to think when you get a snake bite, you just got to get the stuff out, right? Well, in this case, you inject some antibodies around there, and it helps neutralize that virus. So you inject basically as much as you can. If you get bitten on a finger and you're like a 200-pound guy, then they hand you like 3 syringes of stuff and say, hey, lubbers, go inject this into this guy's finger. You're like, okay, I don't think his finger is going to take 30 mLs of it, but you put it close and then you try to instill it in the arm itself, and that gives you some immunity to it. And again, if you do this within 72 hours, essentially 100% effective. You will not get rabies if you are exposed and you do this quickly. And again, even up to a week, 10 days after the exposure, still very effective. Anywhere from like 75 to 95%, something like that, depending on how far it is. But the sooner it happens, the better off. Anybody basically up until the point that they become symptomatic may benefit from this sort of stuff. So even if you're out in the woods and you're on the Appalachian Trail and it's 3 days before you can get to someplace, still go get your shots. It's not too late, and you can really change the outcome in these things. Now, rabies vaccine, rabies immune globulin, the shots, totally, again, essentially 100% effective at preventing rabies itself, for lack of a better term. What about if you actually get symptomatic? I've been saying the whole time that basically it's 100% fatal, and that is essentially the case. However, in the early 2000s, I distinctly remember this, when this happened to this girl. It was a 15-year-old girl who was bitten by a bat and didn't know that she needed to get, they didn't think of anything about it. They didn't think about rabies. 3 weeks later, she becomes symptomatic from rabies and is essentially in the furious rabies state. She goes to the hospital. They put her in the ICU. At the time, there was a big to-do about the Milwaukee Protocol, where she happened to be. What they essentially did was sedate her with ketamine, give her some antivirals, and put her into a coma, and just said, well, let's just see if we can suppress her enough and we give her enough care that we can get her through it. And this girl was the first in at least well-recorded medical history to survive full-blown rabies. Now, what we found since then, and this protocol came out, and they started using it in other people. Unfortunately, the recommendation right now is that it is not actually effective. There was probably a lot of luck involved, and the good critical care, the good supportive care that went into helping this girl was certainly part of it. But it's also thought that she probably was exposed to a less infectious strain and a less severe strain, and you don't want to say she might have survived it otherwise, but she might have survived it otherwise. But certainly the good critical care was really part of it. But not only is it terribly expensive and not really helpful, but it completely infeasible in the developing world, which is where most of the cases are. Again, in the United States, like 1 case a year. All the other cases happen in the developing world, where there's not access to an $800,000 treatment or something like that. So treatment, work is ongoing, but right now we still don't have a good treatment for rabies itself once you actually get sick with it. But if you catch it ahead of time, we've got a great treatment for it that works really well. So take rabies seriously. Rabies sucks, which is why, by the way, you may see people come in, or you may have heard of people like, a bat was flying around in the room and I woke up. Well, did you get bitten by the bat? No. But the recommendation is, could you have gotten bitten by the bat? Yeah, okay, well, you probably need the rabies prophylaxis stuff anyway, because full-blown rabies is so terrible but so preventable that we give lots of people rabies shots, even though probably very few of them were actually exposed to it. But it's incredibly effective and works really well, and is really not that big a deal anymore, other than a few shots. So let's talk about the summing up points. Spinal abscesses are difficult to find. We talked about those in the beginning. Anybody with back pain could have one, but back pain fever, you think a little bit more about it. Back pain fever and neurological deficit probably has an advanced case, and those folks are really bad. So take people at their word. If they say I can't move their legs, all right, they've got a spinal epidural abscess till you prove otherwise. So I don't want to say be nice to these people, but bear that in mind. Drug users get sick too, sometimes in a bad way. Meningitis, the big key is they can't wait to get antibiotics. They got to get antibiotics. If they don't get antibiotics quickly, they will die, and they can't wait to get to a receiving facility. If you're transferring somebody, they need to get some before they leave the sending facility. Critical care is critical in all these folks. Supportive care does the most for it. Don't forget to check a blood sugar. And, of course, as I said, rabies sucks, and stay away from bats. Stay away from terrestrial animals. And if you get bitten, don't make the mistake I did and let the bat go. I didn't actually get bitten, but we had a bat flying around the house, and I managed to catch the thing, took it outside, and then it flies off. And as it's flying off, I'm thinking to myself, wait a minute, where'd that bat come from? Oh, crap. Was he in the room with the kid? Ah, Jesus. It sucks. So rabies sucks. Take it seriously. Don't try to catch the animal yourself. Leave it to somebody else who gets paid to do that kind of stuff. That's what I got on CNS infections. Stand by for a couple minutes. We'll take another break, and then we will talk